Is Achilles tendonitis painful? That's a question that a lot of runners or other active people have when they have an ache or a discomfort around their calf or Achilles tendon, but it's not quite to the point of pain yet. They may think they have an Achilles tendonitis, but they're not quite sure. And so that's the question that we're going to answer in this video. Is Achilles tendonitis painful? Now, if you find this video helpful, give it a like or thumbs up and subscribe to our channel so you can get notified of our future videos. Now, before we can truly answer the question of is Achilles tendonitis painful, we have to really set forth some terminology. That Achilles tendonitis, the term itis, it means inflammation of. So an itis of the Achilles tendon or Achilles tendonitis is an inflammation around the Achilles tendon. But that's rather rare. True inflammatory Achilles tendonitis usually only happens after an acute injury, like pushing off suddenly from a sprint or landing from a jump or changing directions rapidly. You usually know you've injured it at the moment of injury, and it gets better over the course of a couple weeks. But the more common type of Achilles tendon problem is called a tendinosis or a tendinopathy, meaning just an abnormal condition of the Achilles tendon where there's no inflammation present. And so a true inflammatory Achilles tendonitis, the classic hallmark signs of inflammation are redness, warmth, swelling, loss of function, and pain. And so by definition, Achilles tendonitis is painful. But again, that's not very common when it comes to Achilles tendon injuries. But the more common thing is an overuse injury that develops over time from doing repetitive activities, such as running or playing sports, or for people who are weekend warriors who may not be very active most of the time and they get a deconditioned calf muscle or a deconditioned Achilles tendon, and then they go be really active on weekends and then they rest throughout the rest of the week. And that type of condition usually is not painful at first. It's usually just kind of a tightness or a stiffness or an ache in the calves. And over time, if you don't address it, it can gradually start to build up over time until it becomes painful. Or in the worst case scenario, you may just have a sudden rupture where the Achilles tendon breaks. And that's from a tendon that's gotten weakened over time, but you haven't really noticed or haven't paid attention to the signs because it hasn't been extremely painful and it hasn't stopped you from doing activity. So what do you do for an Achilles tendonitis, an inflammatory condition that is painful? Well, the best treatment for a tendonitis is initially to rest it. That the pain is there because it's a warning sign to stop doing whatever you're doing. That with an inflammatory reaction, you get swelling around the tissue, which stops you from being active. You get inflammatory chemicals around the area, which cause some pain, but they also send your brain a message, or your brain sends your body a message to stop doing what you're doing so you don't further injure the tissues. Now, some of those inflammatory chemicals, they draw new cells to the area to help clean up the old injury and lay down new healthy tissue so you can get back to doing the things that you want to normally do. But again, that usually resolves within 2 weeks or so. So the bigger question is, what do you do for a Achilles tendinopathy, one that may not yet be painful? And the key is to catch it before it does become painful. Now, if you're already at that point, you need to start rebuilding the oxygen carrying capacity of the tendon. Because unlike the pain from an acute Achilles tendonitis, Achilles tendinopathy, the pain from that is not necessarily productive. But when you have an acute injury, rest is best. It's usually best to allow that tissue to heal, to protect it, and so you can get back to activity. But acute tendinopathy problem or chronic tendinopathy problems are ischemic injuries, kind of like myocardial ischemia or angina or a transient ischemic attack in your brain or a mini stroke. They're due to a lack of oxygen. And so resting from activity only makes the problem worse over time because you need increased blood flow to the muscle and to the tendon for it to get better and to get the things that it needs to heal and build back up the oxygen carrying capacity of the calves and the Achilles tendon so they can do the sports and activities that you want. So how do you do that? Well, one of the best ways to recondition the Achilles tendon is through high repetition calf raises. And initially, it was thought that you had to do that to the point of pain. The Alfredson protocol, so to speak, was 3 sets of 15 calf raises twice a day with your knees straight, and 3 sets of 15 with your knees bent, again twice a day, 180 total reps per day. But if you already have a painful Achilles tendon, that's not really comfortable to do. So newer research is showing that if you just do as many calf raises as you can several times per day, then over time your tendon gets reconditioned and the Achilles tendon problem gets better so you can get back to doing the activities that you want. Now, just doing exercise doesn't always fix the problem because there's a reason that tendinopathy started to build up in the first place, and it gradually started to get worn down over time. And a lot of times that has to do with either training volume, either overtraining or not taking enough rest between training sessions, or poor running mechanics. For example, pronating too much or pronating too little, wearing worn down shoes or wearing shoes that aren't properly fit for your shoe type. And in addition to reconditioning the tendon, you need to figure out the things that started the Achilles tendinopathy in the first place so that you can prevent the problem from recurring. Now, if you'd like to figure out how you can prevent your Achilles tendinopathy problem from recurring, then we encourage you to reach out to us at More for Life. We'd be happy to set you up with a visit and help you find out what's wrong and how you can get back to the activities that you want to be able to do without your Achilles tendon bothering you. And if you found this video helpful, give it a like or thumbs up and subscribe to our channel so you can get notified of our future videos. Thanks for listening and have a great day.